Infections like cold and flu or sinusitis can increase asthma symptoms. Factors that can cause damage to the coronary artery: inflammation of the tendon connecting the patella, that is the It is said the greatest gift you can give your family and the world is a healthy you. Hello there, welcome to another edition of Telling Us. Let's discuss acidosis. It is said that increased acidity in the blood and other body tissue may be termed acidosis. The pH, that is the acid-base balance of the blood, affects every cell in the body. The kidneys and the lungs function to maintain proper acid balance in the body. Studies say there are two types of acidosis. Respiratory acidosis, which occurs when the lungs cannot properly eliminate carbon dioxide. Normally, the lungs remove carbon dioxide as we breathe out. However, sometimes the lungs cannot get rid of enough carbon dioxide, causing it to build up. This is said can occur in conditions like asthma, chest injury, obesity, overuse or misuse of sedatives, deformed chest structure, nervous system problems, and alcohol overuse. The second type is metabolic acidosis, which occurs when the kidneys cannot eliminate enough acid from the body. Studies say there are three major forms of metabolic acidosis. For example, diabetic acidosis, which occurs in people who do not manage their diabetes properly. Hypercholestemia acidosis, which results from loss of sodium bicarbonate. Sodium bicarbonate is an alkaline that helps keep the blood neutral. Diarrhea and vomiting can cause this form of acidosis. Also, lactic acidosis, which occurs where there is too much lactic acid in the body, which can be caused by chronic use of alcohol, heart failure, liver failure, seizures, low blood sugar, and sometimes prolonged exercise can lead to lactic acid buildup in some people. Symptoms of respiratory acidosis include tiring easily, shortness of breath, fatigue, sleepiness, rapid or shallow breathing, lack of appetite, confusion, fatigue. The breath may smell fruity. That's a sign of diabetic acidosis. Seek medical help if you think you have acidosis, as early diagnosis and treatment can make a big difference in recovery. Most often, it is said treatment depends on the cause. Follow doctor's treatment plan strictly. Studies say maintaining proper balance between acid and alkaline foods in the diet is essential. Our diet should contain 80% alkaline and 20% acid foods. Studies say foods like raisins, spinach, and tomatoes are alkaline in nature, therefore effective in correcting acidosis. Keep the body hydrated by drinking enough water and to reduce the risk of metabolic acidosis. Maintain a healthy weight, as obesity can interfere with proper breathing. Keep diabetes under control and manage blood sugar properly to avoid diabetic acidosis. Take prescribed sedatives accordingly and do not mix it with alcohol. Also, limit or avoid alcohol intake, as when taken excessively can increase lactic acid buildup. Stop smoking, as it can damage the lungs and make breathing less effective. Take measures to reduce or control stress. Always stay on the path of good health. Keep watching Telling Us for more health tips.
Telling Us is produced in association with Crystal TV by Medical Media Group International.